Dobar dan, poštovani gledalci. Počinje još jedno izdanje emisije Život grada. Kao što ste navikli, pratimo aktualna dešavanja ne samo u Novom Pazaru, već i u gradovima u okruženju. Mnogo toga se dešava, počeo je septembar, dakle svi su se uglavnom vratili sa odmora i živaju u Novom Pazaru. Ovih dana, dakle juče, u Novi Pazar je stigla, odnosno počela je posjetu direktorka UNICEF-a za Srbiju, Dejana Kostadinova, koja se sastala sa gradonačelnikom Nihatom Biševcem i saradnicima. Imali ste prilike da vidite taj prilog u našim informativnim emisijama. Gospođa Kostadinova je i gošća radio televizije Novi Pazar i emisije Život grada. Dakle, dobrodošli. Hvala vam puno na posjeti i na početku svakako moramo da pitamo našu gošću kakvi su utisci u Novom Pazaru i kako je protekao jučerašnji dan.
Good morning and thank you very much for inviting me because I'm so inspired of my visit in Novi Pazar. My agenda was very full of meetings. You mentioned in your introduction the meeting with the mayor and his team. And I had also a very productive and very inspiring meeting with a lot of practitioners in Serbia, with the intersectoral body for parenting that has been established in Serbia. And I had a very good discussions with the representatives of the health system, the education system, the social protection system. I had the chance to visit also a primary health care and to discuss with the parents about the vaccination of their children. And also today I had two very good meetings with religious leaders here in Novi Pazar.
Razgovarali ste juče o brojnim temama, pa ćemo i danas pomenuti neke od onih kojima se i UNICEF bavi. I nekako bih počela od teme koja nas negde najviše i boli, to je vakcinacija i na zdravstvene usluge vezane za decu. Naravno, jedno pitanje, zašto je toliko vakcinacija bitna i kako komentarišete ovaj negativni trend kada je vakcinacija u Novom Pazaru u pitanju pre svega MMR vakcina?
In fact, the vaccination, the routine immunization of children is the most success story of health success story in the world. Vaccines saves lives, and nowadays vaccines save every year 3 million lives globally. For many, many years, over the past decades, we were receiving routine immunization. All the people from my generation are vaccinated. But the COVID-19 pandemic had an impact on the routine immunization. We know that for a certain period of time, the process of vaccination was abrupted and it stopped. Also, a lot of questions has been raised regarding the COVID vaccine that after that had an impact on the routine immunization. And the parents have the rights to raise the questions that are important for them. But the most important thing is that we know that parents love their children. And every one parent has the best possible for his or her child. And it is important to take care of children. And vaccinating children is taking care of your child. The problem with the low level of vaccination for children of routine immunization is a global problem. It's not only for Serbia. There was an impact across the world. But over the past 2 years, many countries were trying to catch up with the immunization rate. And Serbia also did a lot for this. So the previous year, there was an improvement. And according to the official data that was published by the Institute for Public Health recently, in Serbia, the vaccination rate is 81% with the first dose of MMR vaccine. In Novi Pazar, again, based on this official data, it is 25%. So there is a difference. And when it comes about the vaccines, all the professionals should work together. The pediatricians should encourage the parents and support them with information why it is important for their children to be vaccinated. What are the risks if their children are not vaccinated? And we saw this risk. Unfortunately, we saw them in Serbia. There was an outbreak of measles in January in Serbia, a disease that has been eradicated, and it's coming back due to the decrease in the level of immunizations. Luckily, it didn't happen to Novi Pazar. There were no cases in Novi Pazar, but it can happen with this vaccination rate, because we know that the community needs 95% of vaccinated children in order to have the protection of the community. So that's why it is important the pediatricians and the visiting nurses to talk with parents, to encourage them to take these steps. The teachers in the kindergarten also to talk to parents. The enrollment in the official education system requires vaccination certificate. It is also important the parents to hear the messages of their leaders. And everyone that I talked with over these 2 days was very supportive for the vaccination. I saw the political will from the mayor that this is an important topic and we should work together in order to ensure that society, the community is supported and it is safe. I saw the commitment of the professionals, of the preschool teachers. I saw the commitment in the primary health care center, and I had a very good discussion, as I said, also with the religious leaders who definitely explained that it is not a problem of the faith. There are questions that the parents are raising, and we are ready to answer these questions.
Kako UNICEF može da negde konkretno pomogne da se ovo poverenje, odnosno da se procenat vakcinisane dece, odnosno kako roditelji da više veruju pedijatrima i da prosto slobodno dovedu svoju decu na vakcinaciju?
We have already started with this work, and recently we supported the primary health care center here in Novi Pazar to organize a meeting and discussion with parents, with practitioners, in order to answer these questions. But we know we live in a very dynamic world, and usually the young people are also mostly in social media, and they receive a lot of information from social media. There is different type of information in social media, and some of them is misinformation. So it is important for young people, for young parents, to ask their leaders, to ask their political leaders, to ask their religious leaders, to ask the teachers, to ask the pediatricians, and to ask the people whom they trust. And we're trying also to support not only here in Novi Pazar, but also in Novi Pazar. We work with the pediatricians to improve their communication skills and the interpersonal communication, how to explain to the parents in the way and to which the terminology that they can understand, because the parents are not doctors, and of course they have some concerns about their child. So they deserve to receive proper information about what is the vaccine, what is the substance of the vaccines, and what is the advantage of the vaccines, and what are the risks if you do not vaccinate your child.
UNICEF se bavi pitanjima obrazovanja dece u ranom uzrastu, ali i inkluzivnim, naravno, obrazovanjem. I sa kakvim projektima ovde ste aktivne, tako da kažem, u Srbiji, i da li ste zadovoljni kako je inkluzija negde obavljena, odnosno realizovana u sistemu školstva?
Early childhood development and education is very important. The first years of every child's life are the crucial ones. And it is very important also to identify on time when there are delays. So that's why UNICEF implements in Serbia a project for early childhood interventions. And we support at national level, but also the local self-governments and the practitioners on the ground, how to establish the services that are needed for the early childhood interventions. And again, this requires support from practitioners from different systems, from the health systems, but also the teachers in the kindergartens, the social workers, everyone who works together with the family. And the center for these early childhood interventions is the development counseling unit that is established in the primary healthcare center, because there are practitioners there that can support and early identify if there is a developmental delay, and also to support to overcome this delay if it's possible, and to support the family, how the family to work with the child, because the parents are the most important partners in this journey. Of course, for some children who has a disability, it is important after that to ensure the inclusive education. And inclusiveness is the core of the society. Compassionate towards people who are different from the others. Support for them. This is the core of our society. And the fact that some children are different doesn't mean that they cannot contribute to the society. Let's remember that some of the brightest minds in our history were with autism, and we have this development as a humanity due to some of their inventions. Inclusive education means that every child has the right to be educated, to be in the classroom together with the others. UNICEF work with the government of Serbia over the past decade for inclusive education, and we implemented a number of projects to support the government, and the results step by step are coming, because now there is a legal framework for inclusive education. Recently, we implemented a project with the general support of the European Union for inclusive education. We train the teachers how to work with children with disabilities. We support them, but also we establish resource centers, 10 resource centers across the whole Serbia that can support the teachers in their work together with the children with disabilities. And 3 of these centers receive also, there will be hubs for assistive technologies, because all the innovations that we have should be used to teach our children, and they can be used in order to facilitate the learning process of children with disabilities. So again, with the support of the European Union, we ensured assistive technologies that could be used. And all these efforts are very important. This is a long journey, but we are very strongly advancing on it, because it is important the children to be together in one classroom. But here, there is one more topic which is really crucial for the success of this reform, and this is the non-discrimination. We should tackle the stigma against children with disabilities. And here, again, every one of us should send the message how important it is to have the children with disabilities in the classroom, all the leaders.
Ali koji su negde najveći izazovi u inkluzivnom obrazovanju trenutno u Srbiji? Šta se negde primećuje? Na čemu treba još više raditi?
I briefly mentioned that according to us, one of the biggest challenges is the stigmatization. The idea that children with disabilities could not learn like the others and could not contribute to the society. And today I've heard something which really hit me, that some parents feel ashamed of bringing their children to the practitioners, asking for help, bringing their children to the kindergarten because they are with disabilities. There's nothing to be ashamed of. This is nature. It is on us to support every one child, and it starts with the parents accepting that they have a very special child, and they can support this child, and also with the practitioners who should support these parents not only with their knowledge, but also they should support the mental health of these parents. They should encourage them to embrace the child and to work with it. It is also about the teachers. Still, there are some teachers who think that children with disabilities should be isolated. We work also on this, and we have a very good cooperation with the Ministry of Education with advancement of this reform step by step, ensuring that all the children are included into the education system.
Jako je bitno u svemu ovome, naravno, i mentalno zdravlje dece i mladih. Poslednjih godina je ovo u žiži, pa kažem, cele države nakon, naravno, COVID-19 i svega što je pandemija donela. Koliko je bitno raditi na da kažemo, održavanju i na poboljšanju mentalnog zdravlja dece i mladih i šta UNICEF radi po tom pitanju?
You are absolutely right saying how important is the mental health, particularly after COVID. In fact, this is an emerging crisis globally, not only in Serbia. But Serbia, as part of the world, is facing the same challenge. And we identified, UNICEF, we identified this topic recently, and we started a program for mental health. We support the government of Serbia and the authorities of introducing a new approach towards mental health, because particularly the adolescent period is very challenging. And when we speak about mental health, usually when people hear health, they think about hospital. It is not about this. It is about the well-being of young people. We implementing a number of surveys in Serbia, and the surveys show that young people don't know where to seek for help. 48% of young people answered that they don't know whom to ask about help, how to find help, and sometimes they experiencing anxiety. Sometimes they experiencing anger or some very light symptoms of depression. This doesn't require very highly profile psychiatric support. This requires support of their well-being. So that's why we identified that there is a need of all the sectors to work together and to provide the services where the children live and play, where is their natural environment. So the teacher, the social worker, the doctor whom the young person is visiting should work together and ensure that in collaboration they can ensure this support. But the most important thing is what is the natural environment of young people, and these are the youth clubs. And this is the place where they are going for enjoyment, but also for building skills, conflict resolution skills, or skills needed for the 21st century environment. And this is the place where they also can receive mental health support. So that's why we're implementing a pilot program in some municipalities in Serbia of supporting the youth clubs to ensure that young people receive mental health support. And we are also training the practitioners in the youth clubs. And we hope that we'll be able also to implement this in Novi Pazar, as a youth club will be established here in Novi Pazar.
Koliko mislite da još prosto treba da se radi u ovim oblastima koje smo pomenuli, evo pre svega na očuvanju mentalnog zdravlja dece i mladih, i hoće li biti takvih projekata, naravno, i dalje u budućnosti, ne samo u Novom Pazaru, naravno, nego i u celoj Srbiji?
UNICEF, together with our sister organization, the World Health Organization, started working on mental health. And Serbia is a country in which our program is very well accommodated, and we are making some very important steps in introducing new approach towards the mental health. But this is a global issue, and we will continue working in Serbia, scaling up the good practice that we already established in some cities, for example, in Novi Sad, and which the government will try to scale it up across the whole Serbia. Novi Pazar is just the next step, but we hope that we can implement it across the whole Serbia, because we saw how important is the mental health. The recent school shooting, which was a major crisis and that shocked every one of us in the society, was a clear signal that young people need support for their well-being. They need support, they need answers to their questions, they need understanding. And again, I'm coming back to the topic about the stigma. It is important to understand that mental health is like any other health. We need to take care about ourselves. And our survey again shows that 47% of young people think that their peers do not seek support because they feel ashamed. They think that they will be stigmatized and discriminated. No, it's normal. Every one of us needs support. So let's embrace this and let's start taking care about ourselves.
I za kraj jedno pitanje, pošto se UNICEF bavi naravno unapređenjem, da kažem, prava i položaja dece i mladih u Srbiji, kako bi ocenila kakav je položaj mladih u Srbiji trenutno? Koliko su upoznati sa svojim pravima, ali naravno i brojnim obavezama?
UNICEF as an organization is present for decades in Serbia. We started our work in Serbia in 1946 and we never stopped over these past years. So we see the advancement of the policies. There are some very good practices that Serbia introduced, and we are supporting the institutions to develop these practices, to make the analysis what else is needed, to tackle the existing challenges. And it is also in link with the question that you raised about the child's rights. We work to inform young people about their rights. And one good practice that we have is our EU report. Because it is not important only to raise the awareness, but also to involve young people and to ensure that they participate into the decision-making process. So through our EU report, through which we are checking the pulse of young people across the whole Serbia, we are asking their opinion on, for example, on some pieces of legislation that the government is proposing, on some policies that will have impact on their life, or on some questions that are important for young people. And we receive their opinion, their proposals, and we ensure that the government has the information when taking the decisions. We also support very much the young people for their participation, increasing in some emerging topics, for example, like air pollution. Recently we implemented a project for youth participation and for support of the local self-governments, how to work in order to tackle the challenge of the air pollution. And this is the way forward. Informed young people who feel empowered to work together with the official authorities to give their proposals and to be part of the decision-making process. And we will continue supporting this.
Hvala vam puno na gostovanju i na ovim lepim rečima i Novom Pazaru i nadam se da ćemo sarađivati i da će se brojni projekti posredstvom UNICEF-a realizovati u Novom Pazaru. Thank you so much.
Hvala puno.
Dakle, gošća radio televizije Novi Pazar danas bila je direktorka UNICEF-a za Srbiju, Dejana Kostadinova. Čuli ste dobre stvari koje je negde pomenula, ali i dosta izazova sa kojima se moramo suočiti kako bi prosto položaj dece i omladine u Novom Pazaru, ali generalno u Srbiji bio mnogo bolji. Prijetan dan, budite uz program radio televizije Novi Pazar.